Hello, doctors and healthcare specialists. Good afternoon. This side Yogesh from Tirupati Software Infotech Private Limited. I am as your IT expert for healthcare specialist would like to introduce a digital HIMS product which will able to enhance your healthcare hospitals plus your all departmental healthcare unit to digitally efficiently manage via Tirupati HIMS product and services via. And our company is running since 2014 and largely maintained via 1000 clientele in India as well as the 75 plus customers are abroadly of the various country out of India. So as you see, this is our website, which is you can go through in detail when you want. What are the feature? How many details of the officially legal the information are available on the website. I would not take time much and introduce our key Tirupati HIMS project, which is what we have and how we can digitally help you to enhance your healthcare activity. Let's go the product. Before we go to the product, I would like to highlight the key feature of the software. Here are the some key feature. The company having 5 to 6 product like hospital management software, laboratory software, radiology, pharmacy, blood bank, and mobile app. And the product is having is capable to manage offline come online deployment facility, local and global, accessible via static IP-based LAN and lifetime validity for offline product and user-friendly and multi-user application, role-based access control, integrated and centralized real-time data access, finance report management, easy to use for the application, as well as the application having capability to maintain LIS and RIS integration with the software, along with the government record compliance application system, auto backup, daily work report are available on email, SMS alert, patient notification plus doctor notification, along with the small equipment connectivity like camera, barcode, attendance device, lab and radiology facility. Parallelly, as in now, the WhatsApp is a key information to sharing the digital information about patient documentation, billing services to go paperless. So we are helping in that. Along with we have mobile application for the users who are interested for cloud version. So let's do, not much taking time. We go to the software product and here we see how our we have features. So as you see here the software information, you can see the duration of the license activity of your license software along with the if you need technical support from our team, you can get in touch with the respective contact details are mentioned in the system licensing. Now we go to the software application and we see what are key features are available in the software. So let's log in here. After login, you will able to see the software having more than 59 modules in the software, which is able to cover all segment of the various department like hospital, laboratory, radiology, store, inventory, doctors section, nursing desk, operation theater, billing desk, super specialty module based like. So we go to the one-to-one implementation, the dashboard, appointment, registration, token display, e-prescription, daycare billing section, OP billing, where you can maintain the billing of various services for the OP patient, laboratory services, radiology, medical sales, IPD file, IP doctor notes, nursing desk to manage your operational activity of the patient related as well as the operation theater module, discharge summary, IP billing, ICU emergency services. Apart from the some super specialty module which are help you to general medicine, pediatric, diabetology, ophthalmology, dentistry, dermatology, IVF section, gastro and liver section, be related disease specialization, orthopediation, pediatric, gynaec and obstetric, Panchkarma, and mortuary department. Apart from these are the patient care related modules to maintain their services. Lower second part is the related to management side where the management can maintain the other activity in the HIMS. Finance report sections, MIS report section, record registers, expense maintenance system, referral manager system, patient MRD section to maintain patient documentation. Even you can manage the master settings where you can create user hospital tariff plans, laboratory service plans, procedure definition, radiology test price and their respective plan with the company-wise, the OPD, IPD packet creation, panel creation, and any other related service definition. In the settings window, you can create bed, allocate the bed capacity, room tariff plan preparation, assigning the company-wide tariff plan. Under pharmacy section, you can maintain purchase, vendor account, sales, stock management, and supply to the other department. Even supporting the store and central store module. Uh, Apart from the medical product, the other consumable product assets management system you can maintain. Under cashless, you can maintain the insurance corporate and cash plan, patient relative settlement activities. Ambulance section help you to track the ambulance facilities of the patient pickup drop purpose. Even you can have the attendance device connectivity and plus the tracking attendance and salary creation, human resources module, payroll sections, canteen module, biomedical, CSSD, complaint section, patient portal, blood banks, chatbot facility, physiotherapy certificate, document management system, parking, SMS facility to communication related information, bulk course, individual sending information, WhatsApp facility, housekeeping, and the optical module. So these are the key features of the HIMS application. Now let's go to the dashboard. What is there? So here you can see the administrator, what day-to-day operations are coming, how many number of patient OP activity and how much collection received from that, as well as the IP admission, the number of admission, as well as the respective collection from that patient. Similarly, laboratory collection and number of patients, radiology patients and collection, pharmacy patient and collection like that. If you can see the bed occupancy system, how much the patients are there, even with the cash collection, UPI collection, debit credit collection. So various mode of the payment wise collection you can see here in the system. Parallel, you can see the ward bed occupancy. When you click, you can see the general ward capacity total is the 35. Out of the 12 bed is occupied, rest bed are vacant. So vacant bed are shown as a green and red bed are means occupied. If you click on the particular bed, you can go through the further patient detail with the name, UHID, relative information, and their advance and total due payment like that. Even you will have the chart to view the how many collection or the graphical information of the system is help you the realistic data information. So here it will system show the cash collection, bank collection, card, debit, credit card wise, and how many patients was registered in OPD, laboratory, radiology, medical, sales, like that category wise data. So this is the graphical data will help you to justify the overall hospital progress. Even you can see the appointment list. If you click the appointment, so you go through the appointment desk, so how many patients are in which doctor or like that. So appointment take record here. So it means it will show you the respective data of the realistic hospital for all departments running status day-to-day operation basis. This is the dashboard window for respective user or admin or director dashboard. Now the next window we go to the appointment section. You will have the facility to create a patient appointment if during the appointment you want to take the patient basic detail, like for example we prepare something information, Rajveer Kumar, patient age we put here, and patient mobile number. So if which doctor we want to show the patients, if there is no record, system say reminder. If you have a respective doctor, the patient data will get here. Here the patient's time slot, which time slot you want to give for appointment and with respective token number, and the patient and basic detail like that. So this is the patient basic detail collection. If you have any taken part payment advance, you can input the part payment entry via mode of payment like that, cash card, UPI, debit, credit card like that. Once you save and print, if you wish to give the patient WhatsApp, you can connect the WhatsApp and email facilities so the appointment registration information can be shared over the WhatsApp. So here is the patient's uh, appointment confirmation slip. This can be sent to WhatsApp and email also if you need it. Now when the patient is coming to the hospital, the receptionist guys or user can make the confirmation of the patient, so we can click on the respective patient here. and this entries will be redirected to the registration desk where the user will be convert this appointment entries to the registration of the patient. So like we created this patient's Maya Kumar as a registration, and here the patient detail is which we have fed during the appointment is reflected here automatically. Now the further if any detail you want to collect like either identification of the patient, and here the consultation fees will be reflect which has been defined in the master of respective doctor based the appointment number and the things will be come here. And once you submit this record, the system will be having option will give a simultaneously printout of the patient's e-prescription printable format plus the cash receipt of the patient which you have taken payment from the patient. So this is the cash receipt of patient along with the patient's e-prescription letter pad appointment document are there. Now let's see what is the next step when the patient are large number of patients in the hospital. So let's assume the patient is in the waiting area. So you can connect to the under the waiting area the token display or TV display with the software. So the token display will show which doctor has to go, which patient has to go in which doctor cabin. So it can be connected to the token display insist. So here also you can provide a facility to nurse. So before nurse patient sending to respective doctor cabin, we can mention the vitals record of the patient. So here we have patient with the UHRD respective token number 29, and we can mention the vitals record here in the particular patient like 86, pulse rate is like 76, and respiratory like 18 by minute, weight is like 47 kg, 120 kg, BMI auto calculated, what is disease or complaint having patient for which he come to the hospital, and how much duration he is facing this problem, and there is the duration of the patient, Fahrenheit or what temperature having. After submitting this record will be updated in e-prescription primary information. This information can be accessible to the respective doctor. Now, when nurse want to send this patient to respective doctor cabin, she click on the accept button. This patient will be reflected in the particular respective doctor cabin like this way. So this was the appointment connectivity based. Now let's assume one walk-in patient registration. So here we will create a walk-in patient Mahendra Kumar Sharma. We take patient basic demographic detail and which department he want to see like patients. We collect mobile number of the patient. If this mobile number already exists, system will give alert. If don't have, it will remind you for that. And you can collect the patient address. If any referral doctor have advised the patient, we can select the respective doctor, Aadhaar card or PAN card, voter ID like that for identification purpose, the document collection and with the respective number. And the patient mode of patient, either it is cash, insurance company, corporate, you can select the company, UHID system generated, and here you keep in mind all field are the red made field are mandatory. And after saving payment mode, the walk-in patient registration you can create from the registration window like this way. On this moment, patient ID card, receipt, and the e-prescription will be generated by the software. After the patient go to the token display as I previously show you, and here the vitals record will be captured. Once the patient has done, the patient will go to the doctor cabin where the doctor can prescribe the prescription to the respective patient. So let's we assume this patient is with the Dr. Nagendra Yadav. Once you select here prescription, you will have option if you want to select any template based like I would like to mention malaria diagnosis to the patient. So clinical vitals record already has been captured by software which was feeded by nurse here you can see, as well as if you want to mention any complaint of the patient what complaints is having in which site like the uh, and what complaint by lungs or body side which part chest something like that, and how many time a complaint is saving to the patient and how much duration like 10 days 20 days like that 17 days. And there is the you can clinical finding advising doctor order or care notes, what investigation you want to suggest to the patient you can advise here, the lab test like this way. And if any radiology services or hospital services you want to prescribe the test, you can add to the particular patient. And these are the medicine parts, drugs parts, where you can advise medication to patient. So we let us assume what medicines and how much tablet for TDS or BDS. You can advise the doses how to be take for the paid duration. So you can select a duration based the quantity, and here the method of use the medicines. And if any patient is critical, we can advise IPD dressing remark, and we submit this prescription or revisit that like that, and it will be generate a computerized printable e-prescription which you can provide to the patient. And these are, you can see the clinical information, investigation requested, radiology test requested, medicine requested, and other services. It is computerized save the prescription. You can email, WhatsApp, or give to the printable provision if you need like that. If we have any external document provided by patient, you can have option to upload the respective document. Now the patient goes to the billing desk where he has to make the payment of respective services that has been prescribed by doctor. So on the billing desk, you will have the list of patient by billing. User can see all the patient. Here, if any particular patient bill has to be done, there a bell icon will be reflecting. And once the user select all investigation or test or radiology items will be reflected to the user side. So user can see this payment is like 9,770 for all about item. If any item patient denied to take, so user can revoke the amount. Either he can check mark after. If we have any discount facility of the patient want to give the user, so he can give the round of discount like that. And cash payment, how much cash, or if patient don't have all money cash, so he can make the multi payment option like 5,000 cash he want to pay, and some he want to pay like debit credit card. So 4,000 he paid debit credit card, some payment he want to keep or it want to keep for due, and he can pay later on when he needed patient. So we save and print. On this moment, the system generate a cash receipt of the respective services which we have prescribed to the patient by doctor, and it gives the printable document to the patient. Now all this item is given to the patient. This receipt will be sent on patient email or WhatsApp if you wish to do so. Now when the next step, this request will be processed during the laboratory radiology services once the billing user have done. Now if you have not using e-prescription digitally by doctor and you want to do the manual billing, also you having the same facility. So just on that moment we can do the billing like CBC or X-ray, parallel or hospital services, dressing, something like that, and you can perform the respective services to the particular patient account like this way. And just save and print, select the payment mode and the save and print, so the receipt will be generated. So this is OP services sections, billing manually performed by the user without dependency of the e-prescription. Now go to the laboratory department where the lab technician will see the respective patient's pending test request which has been billed from the billing desk. So here you have all the patient list. So let's say we see our patient Rajveer Kumar Meena here. Now on that moment we want to collect the blood sample, urine sample of this particular patient. So lab technician will be able to collect the sample and what sample to be collected. So the respective volume can be mentioned automatically coming from master. Just save and print. So barcode sticker will be generated which is capable to punch on blood and urine container. Even you can also correlate to the ELISA interface duration. So this barcode is read by machine to sending the results into the software. So these are the lab integration reference also helpful. When you have machine integration, result will be automatically processed into the software. If you want to do the manual result insert in the software, so you can mention the result of the system patient like 13.5 abnormal value or something, 11,245 20 15 somewhere formula calculated value will be captured by the software. And you can mention the result here in the software of the particular patient. So let us zoom. Here you also see during the result preparation, if any result is abnormal, system making highlight indicator with low or high with the respective detail color code red marking. Let's see, 120 something 180. So I will assuming some test result to prepare the reports here. Borderline. So let me assume some dummy data we are mentioning and 100 like that, and if any positive negative, so we can select the test. Now we save the reports here. Once the report are saved, this report, if this time also remind if any payment is due, so patient have to pay payment before the report is delivered. So this report has been sent to the patient email account or WhatsApp. One, now you want to take the report verified and preview of the system. So this report can be generated via verified by the lab technician, and this report will be shown as the save data or printed the data once report are okay. If any correction is to be done, the pathologist can be correction done. The report will be saved the system. Now the report, if you want to give to the patients on email or WhatsApp, so this report will be can be capable to uh, verified report printable by software system generated. So this time you can have the report with signature added of the pet technician, and this report can be given email or WhatsApp like that. So you see this type of pagination report you can give to the patient on email account like that, WhatsApp like that lab report also. Now there is also having option lab token facility, pending request something like that, email, WhatsApp report, inventory, consumable, asset management system, consumable inventory like that. So these are the part. Here are the bell icon and searching criteria at the top of the page of the laboratory dashboard view. So there is helpful to detail laboratory management system. Similarly, let's go to the radiology service side where the respective patient's lab request or radiology request is pending. So there are two tests was built for this particular patient, and there are the 3 or 4 test requests. So here we will have option to prepare radiology test. There is DICOM integration, PACS integration can be done if the API is also available. Here you can prepare, you can upload the respective X-ray images of the patients, which is provided by machine system side. So let's take some sample copy of the picture. Here another test also like X-ray. And similarly the radiology side, when you prepare a multi template selection option also available. For example, radiology sonography test, we want to prepare whole abdomen report. So while you select a whole abdomen, the respective test for format will be open to here. If you want to select like mail report option, so when you select mail report, here the content will be automatically open for mail report. Even this all report are editable before submitting. All values for normal, no needed observation like that. So we can mention any comment or something, and just if we want to upload the respective sonography images also, we can upload the sonography pictures to the patient and just save image plus text report about this patient. Once the lab and radiology reports are prepared, this report will be reflecting to the respective doctor desk, so doctor can decide whether this patient have to take any further activities or like that. So we can see the image report, either it is we want to give single report or multi-report in the software of the patient. Now when we want to see any video like a sonography report, we want to see image plus text report. So you can see image plus text report which we have prepared in the system software. If you want to see the X-ray film report along with the X-ray film report, so we can see the X-ray or lab report as with the system software like this way in the software. And you have verify options, inventory, consumable also in the same module. Now we go to the doctors to access this is report part, what is the status. So even doctor can see the report part where the lab radiology icon will be reflecting once report are ready. So once I click here the lab report, I can see the lab report. If I want to click radiology, I can see radiology report on clickable here, and you can see the report sections in the respective site. And now the next we go to the pharmacy section to give the patient the medicines of this patient. Okay, one thing, sorry, interruption. There is internet connectivity, sorry guys. So we have logged in software again to accessible, and we go to medical cells once the patient want to collect medicines here, and the pharmacy guy can dispense medicine to the respective patient. So here all requested medicine will be reflected here in the patient account. If out of that any medicine is not available in the store, so system make an indicator this medicine is not available. So user can check any same composition different brand medicine can be given to the patient on the basis of availability and request. But in the prescription the same medicine will not be changeable as that prescribed medicine only. Okay, so the only this requested medicine will be available in the prescription. Once we save payment mode and like that, save and click, so pharmacist medicines will be given to the patients once that was requested by doctor in the e-prescription. So this is pharmacy sales receipt of patient of medicines. And now we go to the admission point of view. So the OPD procedure has been closed. The patient can go to the home. Now let's just say the same patient we want to take the admission. So at this moment we can use the same patient UHID and just to put the tab button, the patient detail will be available in the system software to admit patient. So let's assume we want to admit the patient, the Rajveer patient here. This is with respect to UHID, we can collect the UHID of the patient, and we go to the registration desk here where we can select the patient's UHID, and we can uh, capture the patient detail, demographic detail for admission purpose, and in which ward or bed you want to admit the patient. So you can select the respective ward or bed, and system can see which bed is vacant. So here is one bed is vacant, DX 203, we can admit that. And if at the time of admission we want to collect a deposit amount for part payment, so we can collect deposit, and we can put here any respective amount which we are collecting advance purpose. And the patients why we are making admission, so we can select the surgery advisor procedure what we are advised here like this way, and occupation and basic detail we can mention here, reserve admission like this way. And the mode of payment, deposit, advance, like he paid UPI, so we submit UPI and you can interact with payment gateway and just to save and print. On this moment the system will admit the patient and this time generate patient ID card along with the patient's IP admission consent format, which will be your customized format can be associated with the software. And now we take IP section site where we want to create any consent form, treatment chart, vital chart. So here you will have option to prepare any medical document of the patient like high risk consent care treatment chart like that. So you can select any respective regional language or English language which you want to prepare the medical document of patient consent form treatment chart like that in the system. It can be given to printable window and sign and physical copy. Again scan the copy and upload to the patient's browse file here and upload the medical document like that, anything document you want to upload, and that can be reusable purpose to submit verification demo like that. And this is the nursing desk window is helpful. Now we go to the nursing desk site. So IP doctor want to advise the medical treatment to the doctor. So here will be doctor can prescribe any treatment services to the patient. It is auto suggesting. Nurse can maintain the follow up in the system morning, evening like this side, and what are the treatment is following done. If any medicines request is prescribed by the doctor, so nurse can mention the how much quantity advised to be done, TDS and uh, dosage type, oral or injectable like that. And so this way we can prescribe medicine in a IP patient which is admitted in the hospital, and the method of using the medicines NS 500, DNS 500, 1 ml ODS like this way, body injectable, and just we IP order sheet can be printed for this patient, and the prescription, IP prescription can be printed and shared to the nurse. Now the nurse will able to see this prescription under the nursing desk section, where nurse can see what prescription advice. If any medicines in equipment we have to run to the patient, we can select the multiple equipment like oxygen charges and patient monitor services, so he can mention the IP service. So nursing desk is vital helpful desk to manage each and every event of the nursing patient for IP admit patient. If we nurse see the what lab request has to be given to the patient, so we can able to see the request can be sent to laboratory department from the system and just submit. So this request can be go to the technician, lab technician as well as the radiology services if we want to advise the services, X-ray test order for the particular patient, sonography request for the patient. So radiology service request can be sent via directly the system digitally with the respective order ID. If any medicines request to be performed, so this medicine request can be submitted by nurse, and this request will be go to pharmacy desk. The pharmacy desk will able to dispense the medicine to this patient in the credit payment mode. So this medicine we can supply to the patient. Once the medicine has been supplied to the patient, this will be reflect to IP nursing desk side. So nurse can consume or administer the medicine to over this patient. So here we have supplied this IP medicine to the patient. Now the nurse can mention the administer the medicine to the patient and can be seen here the running status, available quantity of the medicine. Whenever nurse want to consume the medicine, she can mention the timing, what time, how many dose she has consumed to the medicine of the patient, as well as the morning time, evening time. So we can consume medicines marking and how much doses has been consumed, the available quantity, written quantity, uses quantity will be automatically reduced from system software once the nurses administer the medicine to the patient. So let's we do some medications consumption marking like this way. If any super specialty doctor have seen this patient, so we can have the marking the doctor visiting timing and duties. So which doctor have seen to the patient this way, and timely nurse can also able to mention the vital code of patient like BP, pulse, respiratories like 70, pulse rate 16 per minute, weight is 48 kg, 125 height like this. So this way the nurse can capable to mention all the things which is needed to show to the doctor or the use RMO officers like this. So there are various activity we can mention in the system, ward transfer shifting and vitals record discharge, drugs requesting for the patient. Now when the operation has to be scheduled, so nurse can request for operation schedule for this particular patient in the operation department. So the operation department persons can see the bell icon request once the operation to be done. Here the operation technician capable to manage the assistant entries, surgeon availability, staff availability, and who was assistant officer and when the operation to be performed. So everything he can plan for that, which OT complex to be performed, the operation surgery, or what kind of the operation, orthopedic surgery or LSCS surgery. these are the editable plus auto suggestion can be performed from coming to the master. What are the consumable medicine will be required during the operation with the respective quantity we can mention here. And in the system software, so these are the consumable, non-consumable medicines can be addressed in the system software, and what are the requested supporting the instrument required in the operation, so we can arrange for doctor and patient like that, and operation scheduling information can be done, and we can save and print the operation notes to maintain the filing. After once the operation has been completed, we can also complete the post-operative notes during the particular patient. So here post-operative notes we can mention in the system software and export the medicines or the request here. And here we will have post-operative notes of the system, and we can export the notes here, and all the details, medicine consumption, request size is there, and what are the things we have done. So you can press the operation notes after completing a operation. So we can mention the narration, surgeon notes, anesthesia notes, like this way, and any consumable medicine, what was the available quantity, how many consumed. So we can marking that thing, and we can complete the. So here this now we go to the discharge section window, and we can the nurse can able to mention the discharge summary. Before nursing discharge, nurse can also maintain the discharge drug request of this patient here. Discharge drug request. So what are the drug requests to be done here, and duration for TDS after meals, 2 days TDS, and we submit this record. Now, when we request the discharge request of patient, we request here the discharge, and we see what are the open services. If you want to send this request with the with this running status, we can close the services, and here we can close any open service of the patient site. We can stop the instrument, and all the things we can submit their system. So here we have patients, and if now go to the discharge sections here, we can able to see all running medical history of the patient from admission to discharge. What was the lab investigation report? Let's see, here are the lab reports are not available of the patient, so that the report is pending. So let's prepare his lab report. So we are preparing here report of the patient. To see this report are coming into the discharge summary, so you can able to see how the discharge data is capturing from laboratory, radiology, medicines, all the department services. Okay, so this way you will have option to prepare all the information in the software.